loved one may be watching this video because you're suffering from hypothyroid conditions or Hashimoto's. Now, the thyroid gland is one of the most misunderstood organs in the body, misdiagnosed and mistreated. And some of the symptoms that you may be experiencing are fatigue, constipation, cold hands, cold feet. Your hair may be falling out. And you could be on medications and you're still having the symptoms that you had even before you took the medications. So I kind of want to go over how the thyroid works, why the thyroid works, and why you have to have a healthy thyroid to stay healthy. Because it's one of the most important organs in your body as far as the metabolic rate is concerned, where all the cells in your body have to make energy. In order for each specific tissue in your body to function, like muscles, bones, your heart, your liver, your gallbladder, your bowels, they're all different tissues, but they all need a T3 hormone from your thyroid. So let's just sum this up a little bit. Our bodies are made of trillions of cells. T3 has there's receptor sites on every cell in your body for T3. Now, if your thyroid is not putting out the T3, or your body's not converting to T3 and getting the T3 into the cell, you are not going to feel right. You're going to still experience, if you're on medication, still experience hypothyroid conditions, especially if you're autoimmune. And so let's break this down a little bit. Now, I'm going to give the organs to you that we're considering here, so you'll understand. We're going inside the brain right now, and we're looking at the hypothalamus, the pituitary, the thyroid gland, the liver, the gallbladder, the intestinal tract, the bones, the muscles. How about your hair and your skin? We're going to talk about all these, all right? So let's start with inside the brain. Now, the hypothalamus feeds information to the pituitary gland, but the hypothalamus has to have proper amounts of serotonin and proper amounts of dopamine. Now, we have different ways of assessing the serotonin and the dopamine insufficiencies in your body, so if you have a problem there, we're going to be able to pick it up. Now, with the hypothalamus working properly, it's going to send its thyroid-releasing hormone signal to the pituitary. The pituitary gland, in turn, is going to fire off the signal with TSH to the thyroid gland. And at that point, under normal healthy situations, the thyroid gland is going to make T3 and T4. But the conundrum here is you have 93% being produced as T4, which is non-usable at that point, and T3, which is 7% usable. So what happens at that point? Well, T4 has to be converted to T3. It gets converted, 60% of it gets converted in the liver, 20% gets converted in the bowel, and the other 20% gets converted throughout the entire system. So let's go back again into the brain. So if you have proper serotonin, proper dopamine, the hypothalamus is going to function properly. All right? Then the pituitary gland, if it has proper amounts of thyroid releasing hormone, the pituitary gland is going to be happy and release thyroid stimulating hormone, which is going to make the thyroid happy, and the thyroid is then going to produce T4 and T3. So when the thyroid gland produces T4, T3, T4 is carried and bound by a protein. We call that like the school bus. And T4 is transported to the liver, transported to the bowels by thyroid binding globulin. At that point in the liver, the thyroid T4 is converted to T3. which is then taken to the cell, and the cell is happy, and then it makes energy, and it also is making DNA. So the main reason that for human beings is to express their gene. And so we need to make energy, and we need to express our genes. And at that point, if you have proper T3, proper oxygen, proper glucose in the cell, and all the things that it needs to make that mitochondria in the cell make energy, then you're going to be healthy, and you're going to be happy, and you're going to have a good life. But so many people that have come into my clinic over the last 31 years, you can almost tell just by looking at people, by talking to people, that they're not right on. They're not healthy. They don't feel good. They're not happy. They're taking medications. Some of my patients, and even some of my family members, 10, 15 different type of medications. And you can make a patient look healthy on paper, but do they really feel healthy? Are they expressing their true God-given health? Well, let's go back and review. So, proper dopamine, proper serotonin. That sends signals to the pituitary. The pituitary then releases thyroid stimulating hormone. Thyroid stimulating hormone talks to the thyroid gland, and it's releasing T4 and T3. T4 gets converted in the liver, and that's 60% of it, to T3. The other 20% gets converted to T3 in the intestinal tract. Then the T3 goes to the cell. Okay? Now, some other things happen too. You have reverse T3, which we don't worry too much about right now. Okay? That's non-usable. So, in the bowel, where the T4 gets converted to T3, you have to have 5' deiodinase enzyme. And that then converts to T3. So what are we looking at? The school bus that carries the protein that carries the T4 to the bowel, to the liver, has to also be intact. Back up into thyroid, you also have to have thyroid peroxidase enzyme. This is where iodine connects to tyrosine to make T4 and T3. 4 iodines and 3 iodines, T4, T3. First of all, we brought up the hypothalamus and the serotonin and dopamine. Now, serotonin is kind of the happy hormone. Dopamine's the motivational type of hormone. So if you see that you're losing your interest in your hobbies, your personality's changing, your memory's changing, you're not motivated to get up and go to the gym anymore, you're to do some of your favorite things like stamp collecting or painting. We're looking at this. You have to take this into consideration. Is the hypothalamus still healthy? Now, if that is not producing, if the hypothalamus isn't working properly, it is not going to produce the right amount of thyroid-releasing hormone that's signaling to the pituitary gland. Now, the pituitary gland, if you're not signaling to that properly, the pituitary gland is going to appear like it's functioning lazy. It's not going to function at 100%. And if the pituitary gland is not functioning at 100%, then it's not going to have proper signaling to the thyroid. So we can have a serotonin or dopamine problem, a hypothalamus problem. If that's not working properly, the signaling to the pituitary is going to appear that it's not working properly either. Medically, what your MD has traditionally done since the 1960s is for sure run a TSH test, but maybe a T4 and a T3. Now, it could be because of a misunderstanding or a lack of caring or You know, just I think if they the medical world understood the thyroid a little better, they'd probably perform a little bit better for their patients. But on my side, I'm seeing a lot of the hypothyroid conditions. So if that thyroid gland is not being signaled to properly from the pituitary gland, then that thyroid gland is not going to function properly. You have to produce proper amounts of T4 and T3. You have to have a healthy liver, a healthy gallbladder. So let's talk about some of the organs in the body now. Thyroid crosstalks with the liver, the thyroid crosstalks with the stomach, the thyroid crosstalks with the skeletal system, the thyroid crosstalks with the skin. And so if you're having, let's just say that you've had a standard American diet full of processed food, and America is becoming more and more obese. So it's not just the fat on the outside of the body that's accumulating around your waist, around your legs, your hips. Fat can accumulate in and around the liver, and it can become sluggish. The gallbladder may not work properly. So at that point, one of the most common surgeries is gallbladder. And when the gallbladder is cross-talking back and forth to the thyroid, everybody's happy. But if you have a sluggish liver and a sluggish gallbladder, things are not going to happen properly. The bile in the body that's produced by the liver and released by the gallbladder, it combines with hormones, male, female, cholesterol, and it eliminates these things. So if you don't have proper function in your liver and your gallbladder, the thyroid is probably not going to be functioning properly. But if you have a low functioning thyroid, you may not have a healthy liver or a healthy gallbladder. You're not going to have healthy fat digestion, because bile is like a detergent. It helps digest and emulsify fats. So if you're having pain in your right rib cage or in your right shoulder, you might want to, you may consider or may be suffering from a little bit of a liver gallbladder issue, sluggishness. Now when the liver and the gallbladder get sluggish, what happens? The bile gets viscous. It becomes thick. And then that's when the crystalline state, the bile starts turning into more crystalline. And then it can actually produce stones. By the time you get that sick of a gallbladder, your body has gone through years of poor diet, too many processed foods. Now, let's move to the stomach. Since there's crosstalk from the thyroid to the gut, the stomach, let's talk about indigestion, reflux, or acid reflux, GERD. All these are being medicated by antacid type of medication, Nexium, Prilosec, Prevacid, Tagamet. All these things are to help calm that stomach acid down. The problem is that I see in most of my patients that come into the clinic is that you have hypo or low stomach acid. It's not that you're producing too much stomach acid all the time. It's you produce too much stomach acid when you eat. And so you're blowing up inside with the stomach acid. And then you're going to belch it back up. You may even vomit some up in your throat, which burns really bad. So if you have poor stomach acid, the stomach acid basically sterilizes the food in your stomach. It helps. It's a protective act. It has a protective activity. It fights against bacteria, parasites. But if you have low stomach acid, you are vulnerable to bacteria, bad bacteria, parasites, things that you don't want in your body. And so let's move on to your intestinal tract. So if you have poor motility, like constipation, the thyroid, it plays a huge role in that. One of the major symptoms for thyroid is constipation. And also a big player is anemia. Anemia is when you're not carrying oxygen to the body. Oxygen is huge. Your brain needs it, your toes need it, your skin needs it, your muscles need it. If you have an anemia type of problem, you have low oxygen delivery to the rest of your system. You could be looking at muscle cramping, neuropathies, even passing out, lightheadedness. It gets a little scary when you get like that. But if it's something as simple as anemia that may be able to be fixed simply, and when you look back at the stomach, you have an intrinsic factor in your stomach that with normal acidic levels in your stomach, you will absorb vitamin B12. But if you have an intrinsic factor antibody problem attacking the intrinsic factor, you're not going to absorb B12. That can create an anemia problem. But B12 is very important for the health of your blood. So let's get to the muscles. The muscles. If you're cramping at nighttime in bed, that's a very common symptom when you're stretching out and all of a sudden your calves start to cramp up. That's not fun. That's not fun. But why does it happen? Is it because you're working out too much, or is it because you have poor oxygen delivery? Well, most Americans don't work out half hour a day. So I would probably relate it more to non-activity. And when I'm looking at patients with thyroid problems, I'm relating it back to thyroid, because you have to have proper amounts of T3, remember, to get to your muscles. If your muscle cells do not have proper amounts of T3, your muscles aren't going to work properly. When you're working out and you start to cramp, is it an electrolyte problem or is it a T3 problem? Okay? So let's talk about the bones, the crosstalk with the bones with the thyroid. The thyroid, with proper amounts of T3 being produced and absorbed with the bones, our bones are making blood. Our blood is made in the bones. So if you have low T3, you're also going to have poor development of blood. Now, our bones are constantly breaking down and rebuilding themselves. If you have low T3 in your system, your bones are not going to break down and build back up. What's one of the real common things we do today? We go get DEXA scans. We get the, you get the Med24 checks, whatever, and they stick your foot in a scan and you have osteopenia, or you may even be further checked for osteoporosis. Now, if you don't have enough T3 in your body, your bones may become brittle. Maybe just for that purpose. It could be a calcium problem. It could be a parathyroid problem. But right now, for this purpose, we're looking at thyroid and T3 and the basal metabolic rate. If your bones are not getting the proper amounts of T3 being converted in your liver and your intestinal tract and then into your system, you may have brittle bones. So osteoporosis is running rampant in this country. So it's something to think about, and that's what we look for. Hair falling out, skin problems. I mean, if you do not have enough T3, oxygen, glucose going to the cells, you may not have healthy hair. Some of us, like myself, genetically, I mean, both my grandpas are bald as cue balls, but women that are finding more hair in their brush and in the shower, that's another problem. I mean, if you're not having proper amounts of T3 delivered to your cells, you may have bad hair fallout. You may even get alopecia. This is where you get patches of hair falling out. We've treated several patients like this where their hair has actually come back. And some of our, if you look on lifechangingcare.com, you can see hundreds of testimonials of patients that have actually succeeded and they're getting their lives back. Now, what do we do that makes us different in our clinic? Well, I test my patients neurologically and metabolically. We do a complete neurological exam. We do a complete metabolic workup. So let's talk about the metabolic workup. The metabolic workup consists of a complete metabolic profile, a complete CBC with a differential, fatty lipid panel. We look for a complete thyroid panel. with all the markers. We don't leave any stone unturned here. We don't just test T4 and T3 and TSH. We look at all the different markers. And I'm going to talk about the 6 patterns of thyroid here in a minute. But let's get through the metabolic testing. We do saliva testing. We're checking for cortisol. We're checking male and female hormones. We're checking progesterone. We do stool. We check for parasites, yeast, mold, fungus, okay? We also do sensitivity testing. This can be done through stool samples to determine if you have sensitivities to gluten, soy, dairy, egg, yeast, molds. If you're sensitive to any of these food groups, it could be making your condition worse, as it will increase your inflammation throughout your whole body. And like I said before, we test for fibrinogen, we test for C-reactive proteins, we check for homocysteine. So we're going to be looking at and checking, lifting all these stones to check for inflammation. If you have the following symptoms, you could be suffering from sensitivity to gluten, soy, dairy, egg. And here's some of the sensitivity symptoms: chronic fatigue and chronic pain, bloatedness after you eat, gas. You can also have constipation, and you might even vomit often. The only way you find this out is if you do the testing. If you do proper testing, you can find the problem. The next step we do is adrenal stress testing. We're looking to check for cortisol levels. Cortisol is inflammatory. When we further address your adrenal glands with a test called the adrenal stress test, this is a salivary test where we test your saliva throughout the day. And this will give us a full spectrum look at the cortisol, what we call circadian rhythm. So if you're suffering with sleep, this test will help measure your cortisol levels. People that can't sleep at night, you may have high cortisol levels. People that can't get up in the morning, you may have low cortisol levels. So if you're having fatigue, cortisol also plays a role in affecting the brain, the thyroid, the gut. So under normal circumstances, cortisol, you don't want high levels of cortisol in your body when you're trying to rest or relax. It's a stress hormone. I mean, when you're in a stressful situation, cortisol is naturally being produced. We also look for autoimmune disorders. We may test to see if you're autoimmune because we want to know if your body's attacking the thyroid. And autoimmune disease is where your immune system can attack any other part of your body as well. So if you have a thyroid problem or Hashimoto's, this is the autoimmune condition where your body's attacking the thyroid gland. So we test the specific antibodies to determine if you suffer from any of these autoimmune conditions. For example, many chronic pain, chronic fatigue patients that I've treated tested positive for thyroid antibodies, and they were actually misdiagnosed. So if you're on medications with Synthroid or bioidentical hormones, Cytomel, if you're autoimmune, you may not need that hormone. But that's between you and your MD. So if your thyroid tissue has antibodies, TPO and TBG, if they are high on your blood test, you're suffering from Hashimoto. This disease is where your body's attacking its own tissue. Google it. We also look for neurotransmitters, which we're going back to the serotonin and dopamine. We do assessments on that. We also look at hormone panels. We're looking at male, female, testosterone, estrogen, progesterone, and also cortisol. So some of these things that can happen with male and female hormones are fatigue, hot flashes, sweating, anxiety attacks. So, you know, those are kind of inexplicable. And I have lots of women come into my clinic. I'm having anxiety attacks. I'm having sweating attacks. And they're taking the hormones. But their symptoms aren't going away. And they also say that, hey, my MD just raised my hormone level, and I'm still having the symptoms. So the only way you're going to find this out is if you run further testing, specific testing, that you can find where the inflammation is actually getting through into your system. So, like I said, we're looking at homocysteine, C-reactive proteins, fibrinogens. These are inflammatory markers that attack the bilipid membrane of the cell. We, at that point, then, we pretty much can assess the whole gambit of the Hashimoto's or the hypothyroid and why it's affecting your body. So now that we've gone through all that, what do we do to treat? What do we do to manage? Well, that's unique in its own as well. We use glutathione. Glutathione is a protocol that we use that your body makes glutathione, and it's your super antioxidant. So we need to examine this. We use it heavily in our hypothyroid and Hashimoto's autoimmune cases. We also use oxygen therapy, air concentrators, to increase the oxygen to the brain and the rest of the cells. And like I said earlier, in order to have a healthy body, you have to have proper amounts of oxygen, proper amounts of glucose, and proper amounts of T3. These are main constituents that we're taking into consideration. We do oxygen with exercise in our clinic to help increase those levels. We do brain-based therapies. We use specific brain-based therapies such as vibration, auditory, visual, olfactory, caloric stimulation. We do spin therapy. We do laser therapy. We use cold laser in our office to help increase the healing process. We do non-surgical spinal decompression as well. We use interactive metronome. Interactive metronome is a unique and cutting-edge machine that we use. It's a computer-based program that uses visual, auditory, and motor stimulation to increase firing to the brain. So Google it, look it up, interactivemetronome.com. Once we've run all the necessary tests to determine your specific condition, we can successfully treat you by proper neurological and all of our and also with our natural nutritional protocols. Ask yourself the following questions. Number one, how's your chronic health condition affecting your job, your relationship, your family, and other activities? What's it cost you in time, money, happiness, and sleep? You know your life. You're living it. You can experience it. So you know the answers to that. Where do you picture yourself in 3 years from now, 5 years from now? Are you getting better? Are you staying the same? Or are you getting worse? So you need to ask yourself this question. What's it worth to you if you could improve your life? What's it worth to you to get your life back, get your health back? Here's what to do next. If you're really serious about the possibility that there could be an alternative treatment for you or your loved one to get your life back and get your health back, please call the office at 260-482-2206 in Fort Wayne, Indiana, and tell one of my staff members that you're interested in setting up an appointment for your thyroid screening and have the most rapid shift back to health. Give us a call. Thank you very much.